Good evening. I'm Derek Denton with Channel 213 News. Tonight's top story, an infectious disease at your child's daycare. What you need to know for this upcoming summer months. Courtney?
Thank you, Derek. With increasing warmer weather, reports of young school-age children infected with the virus Herpangina. Several Denver schools have reported over 50 cases of Herpangina in the last few weeks. Similar to hand, foot, and mouth disease, the viral infection is caused by several enteroviruses that typically affect the GI tract. In particular, it's caused by the subgroup Coxsackie virus type A and is most commonly transmitted by fecal contamination, saliva, and respiratory droplets from a sneeze or cough. Young children are more at risk due to their weaker antibodies, making it harder for their body to fight off the viral infection. Symptoms do not immediately arise and can incubate in the body for up to 2 weeks, where the child presents asymptomatic. This is when the virus is most contagious and can live on surfaces like toys or countertops for up to 7 days. After the incubation period concludes is when symptoms present with sudden onset of high fever and sore throat. Children most commonly complain of headache and difficulty swallowing. Symptoms you can expect to see include uniquely white to gray colored ulcers surrounded by a red halo on the roof of the mouth, anterior pillars of the tonsils, and uvula. These blister-like lesions can also be located on the lips, gums, and tongue. You can expect these symptoms to last between 3 to 6 days. We're now going to go live with our field reporter, Billy Bicuspid, with more on this viral outbreak.
Thank you, Courtney. I'm here with Dr. Deborah Distel to tell us more about Herpangina. Hello, Dr. Distel. Thank you for joining us today.
Yes, thank you for having me.
Doctor, can you give us a brief history on the Herpangina?
Why, yes, Billy. The Coxsackie virus A was first discovered in 1947 during the polio outbreak in Coxsackie, New York. It wasn't until the late 80s of the discovery of Herpangina, which is closely correlated with hand, foot, and mouth disease.
Crikey. How would you diagnose this virus? How can it be treated?
Well, Herpangina is diagnosed clinically by its unique appearance, a thorough health history, and physical exam. Herpangina is self-limiting and unfortunately cannot be treated with antibiotics. NSAID therapy and acetaminophen can help reduce pain and fever. Topical anesthetics containing lidocaine can also help relieve pain. I also recommend drinking lots of fluids and popsicles to help soothe the throat.
Oh, I love me some popsicles. Dr. Distel, what would you recommend for parents listening at home today?
Well, I would recommend keeping your children home from daycare or school if there is in fact an outbreak or your child presents with any of these symptoms. This virus is highly contagious, and I would encourage great hand hygiene for both parents and their children to prevent any contamination. Also disinfecting any hard surfaces and avoiding saliva transmission.
Well, thank you, Dr. Distel, on your insight on the Herpangina. I'm Billy Bicuspid. Back to you guys in the newsroom.
Bye.
Thank you, Billy. Dentists and dental hygiene professionals are also asking you to keep your children at home. This is important for prevention of any further contamination. We will keep you updated with any new news on this outbreak. That's all that we have for you tonight. Special thanks to Dr. Deborah Distel. I'm Courtney K9.
And I'm Derek Denton, reminding all of you to keep your hands washed. From all of us here at Channel 213 News, stay classy, Colorado.